Jawad Darwish is only 15 years old. He was playing with his friends when a shell hit his neighborhood in Damascus. He lost his hand and part of his genitals in the attack. Jawad had surgery in Syria and then his family fled to Lebanon. But now they might have to go back. Jawad needs another operation and an artificial hand. But his family can't afford paying for it in Lebanon, and aid organizations are not helping. They tell us to go to Damascus, says his uncle, because it's too expensive here.
I will take him to Damascus and put our lives at risk, just not to lose another child. We didn't pay for anything in Damascus except medicine they didn't have in the hospital. But they are the ones that launched the shell.
And so Jawad's family is left to seek help from the government they say is responsible for inflicting his injuries. This is exactly what Amnesty International means when it says Syrian refugees in Lebanon are faced with agonizing choices. Syrian refugees have little chance to get the health care they need here. In Syria, health services are free to all, but in Lebanon, it's a private system. Health care is not affordable even for Lebanon's poor, and so most Syrian refugees can't afford treatment here. The UN and other aid agencies say they lack the sufficient funds to provide for all the refugees' needs, so they end up prioritizing. The need for health care is huge. The camps where the refugees live have no proper sewage systems. What food there is gets contaminated. Disease spreads quickly here. This doctor volunteers to help the refugees. He gets frustrated when he sees easily treatable illnesses become life-threatening due to the lack of available care.
There are many cases that need expensive treatment, like x-rays and scans, but this is all very expensive here in Lebanon. The Lebanese government cannot afford it, and the private hospitals are not obliged to cover the costs.
Fahad is 6 years old. He's been diagnosed with a brain tumor and needs chemotherapy. To get the treatment he needs, his family spends around $300 to travel to the war zone in Damascus.
We sacrifice our lives for the sake of our child. The road to Damascus is not safe, but we have to go.
Refugees like Fahad and Jawad are now forced to return to the war they escaped. Rula Amin, Al Jazeera, Lebanon.